Welcome to another live stream of the Menopause Method.
I'm Dr. David Rosensweet.
And I am Joshua Rosensweet.
Yes, you are.
I am. I always am.
I recognize you.
And today we're going to talk about one that's I found really interesting, and that's when things don't necessarily seem to be related, but they are. So presumably you're here because menopause is high on your mind. But what if you're facing something else in life that doesn't seem related in any way, shape, or form? Pick something you're experiencing. And one of the things I've learned from Dad, Dr. Rosensweet, is that the knee bone's connected to the hip bone. Is that right?
No.
It is. Sort of. In many ways, and many of them, it turns out, circle back around to hormones, and thus why they're the topic of today's subject.
And the way that we encounter that in clinical practice is a very common way. Because if a woman has yet to experience menopause, very often it creeps up on her and she doesn't actually even think about it.
Yeah.
And that doesn't stay the same. There comes a time when many women do think about it. But I like to look at it from another perspective. A 42-year-old woman shows up at my office and she says, I have chronic fatigue and I've had it for many years. And I'm exhausted and I can't sleep and the sleep has gotten worse. And this is a common clinical situation where women are not feeling well, and I'm zeroing on women because this is the menopause method. That's a very similar thing happens to men, that's for sure.
Yeah.
And that what we teach doctors and nurse practitioners is when a woman in the midlife, 40-year-old plus, 35-year-old plus, demographic comes into your office and has a variety of health challenges, think about, could this be related to menopause? And if so, treat the menopause and see if anything's left, because diminishing hormones is a big deal. And that's what happens. You know, we all, men and women, we peak in our hormone amounts when we're in our 20s, and they decline. After that time, we're getting less and less hormones. Well, hormones are very unique. They're so powerful.
Yeah.
So when they decline, you feel that. You get someone who gets declining thyroid hormones, they get exhausted, they get constipated, their skin, their hair, lots of things changes, their bowels don't work, et cetera, et cetera. These hormones are so powerful, they're needed for day-to-day function. Same with ovarian hormones. You get declining estrogen and progesterone, it can sneak up on you. It can masquerade, and this happened the other day when I was consulting with a doctor. This woman had severe episodic anxiety and depression.
Yeah.
And she also had depleted energy and she couldn't sleep. And she was in her late 30s. And I'm sorry, this woman was 50. And she had just glided her way slowly into this whole situation. Her last period was 3 years previous. And when she showed up at the doctor's office, it looked all the world like chronic fatigue, fibromyalgia, these generalized terms, and sleep disturbance. And it turned out that the elephant in her room were these massively low, to be expected, it wasn't an illness, ovarian hormones. So the place you start when you're midlife-ish and you've acquired these things that they come on so slowly, but they are significant, think first of menopause and the replenishing, the proper replenishing, the expert replenishing by someone who's taken on menopause as a specialty caring and educational adventure that they went on, a health professional who's done that, because so many things can relate to menopause. Like I'm repeating myself, but like we tell doctors, when a woman of perimenopausal or menopausal age comes into your office and she's got a wide variety of small, medium, large, and very significant complaints, treat the menopause first, see what's left. And the shocker is, so many times treating the menopause takes care of most of what's going on there.
Things that the doctors don't necessarily know are connected, but
Exactly.
certainly the patients wouldn't. They would have no idea that this thing they're experiencing is so related to being low on hormones.
And to give you an extreme example, a patient showed up in my office for her first consultation. She was 50-ish, and she was, in the course of taking her medical history, I saw that she had been taking OxyContin for a year. And I'm sitting there in my chair going, do I really want to be dealing with a OxyContin addiction here? Why was she taking the OxyContin? Severe joint pain, arthritis, is what as she was told.
Yeah.
And it was
And she
obvious.
was taking doses extreme enough for you to get concerned.
And OxyContin is an addictive narcotic
Yeah.
that is extremely effective in eliminating pain, but it's extremely problematic over the long run, extremely. So, but she had come to me for menopause, and I sort of was talking to her and thinking, you know, she seems like a responsible and caring person. I'm going to risk it. And I can always refer to an addiction specialist if it comes to that. And I put her on an ovarian hormone replenishing, and about a month and a half later, I run into her in the parking lot of one of my favorite health food stores, and she tells me, I'm totally off the OxyContin. I stopped it cold at 5 weeks. All my pain is gone. Now, this is an extreme example. This woman didn't have arthritis. She had joint pain related to estrogen deficiency. I'm giving you an extreme example. There's far more common examples of can't sleep, insomnia. That's 3 nights of insomnia and you're done for the week. And mood disorders, severe anxiety, severe depression even.
Yeah, you've mentioned this one. Like a woman can have racing mind that she didn't have in her 20s. Now
Right.
she's got it, but she's not
In the
connecting
middle of the
the
night,
dots.
no less.
Someone very close in my life had this.
Yeah.
And why would she? Why would she connect the dots? But there it was. And just the introduction of hormones made a radical difference in her emotional state of mind.
Yeah, so perimenopausal, 40s, 50s, even the 30s, have unexplainable things. Go get thee to someone who's really knowledgeable about treating women in menopause with bioidentical hormones. It may not be the key to the highway. You may have a diabetes that you need to attend to, or coronary artery disease, or a list of symptoms so long you can't believe it.
Yeah.
But don't leave out the hormones. So.
Great. Good thing to understand.
Mm-hmm.
We have lots of questions today. Let's see how many of them we
Sure.
can get to. We have one from Debbie. She's in Santa Clarita, California. And she says, besides BHRT, that's bioidentical hormone replacement therapy, do you have a doctor who also specializes in mold detoxification? Can my current physician order your products? Can I order your products if I have a prescription?
One thing at a time. There's 4 good questions in there.
Yeah, right. Well, we're done for today. We'll answer these. We're done.
Mold. Woohoo!
Yeah.
And it turns out in California and in lots of places, we have an expert. And if you go to the Menopause Method and find a doc, and the woman who handles these for us will refer you to a physician who's now in Lake Tahoe that knows a lot about mold. Because mold's a big deal, and some people get really sick from mold and other people don't. But if you're one who has the, mold exposures and you want to handle this piece, it can be a very significant piece. And it turns out one of the physicians that who's in our certification program to help women with hormones, happens to be an expert in that, or someone in their group is.
Yeah.
They encounter it all the time. Now, I'm sorry, what was the other part of it?
The second part is, can my current physician
yes.
order your products?
Well, what are our products? We're teaching physicians and nurse practitioners about bioidentical hormones.
Yeah.
And ultimately, 2 of those for certain, and all 4 of them are best applied to the skin. And the product that we've developed, and actually have a patent pending on, is putting in an organic oils mix. And in order to get that organic base, we provide everything the pharmacists need, except the hormones. They provide the hormones.
Yeah.
Any compounding pharmacist in the United States for sure, and we're now exploring other parts of the world, can purchase that kit and give you the very bioidentical hormone products that we think are the safest and best for the long haul. Can you order this? I'm sorry, these all have to do with placing hormones.
She asks it in a unique way. She says, can I order your products if I have a prescription?
No.
If she has a prescription.
Not from us. We're not pharmacists. We don't provide the hormones.
Right.
Yet, if you have a prescription, the prescriber, your physician or nurse practitioner, can order those for you, because we're dealing with many pharmacies in the United States that are carrying this now.
Yeah.
2 of them have licenses in over 45 states. That means that, and they can ship to California. You have to be licensed to do that.
Right.
And it takes a unique pharmacy to do that, to be licensed and to be. And we yet to have a compounding pharmacy in California, but you could walk into your local compounding pharmacy and ask them, would you like to do this? And then take them to our website. They get it really quickly.
Yeah.
Or you can say to your physician or nurse practitioner, I'd like to have my hormones in the organic oils as the base. And your physician can contact us, the physician can go to the website, the physician can turn to their local compounding pharmacy and say, hey, listen, I want to prescribe these hormones that are in this organic oils base. That compounding pharmacy can order what they need. They'll have it within a couple days.
It's all starting to sound a little complex. I think at its core it's pretty basic. Any compounding pharmacist in the country can carry our base if they want to. They can order directly from us. Any doctor can order from the existing compounding pharmacists if they want, or they can help facilitate getting these relationships going with new pharmacists. I don't know if I made it simpler or more complex.
Sure, no, that's it.
Good.
That was the correct explanation.
Good. Good. Hey, man, we got through her questions fast. We now have Claudine. She's in Houston, Texas. And she writes, I need organic bioidentical progesterone cream and a doctor to monitor my treatment.
There is no bioidentical, there is no organic progesterone cream.
Yeah.
Because creams are solvents. There is organic oils, and progesterone can be prescribed in organic oils.
Yeah.
And we started to answer that in the previous question.
Right.
And then, yes, if you go to, we have a physician trained in Texas, and if you go to menopausemethod.com, find a doc, you'll be connected. And if you're far from Austin, this particular physician, who really is good at this stuff, you can work with her by telemedicine. That means you can sit in front of a computer web conference no matter where you are in Texas. And she can, providing you have your own local healthcare provider, professional, that will do annual exams, physical exams, and attend to your basic health needs, the whole menopausal work that you need done can be done very easily by telemedicine, as sanctioned by the states, the United States. It's a rapidly growing field.
Yeah.
And our particular physician in Austin is capable of doing this.
And menopause lends itself really nicely to this. I think there are treatments, knee surgery does not lend itself yet.
You can't do telemedicine.
Because physical touching matters.
Although surgery is being done.
Yeah, I know,
by
it is,
telemedicine.
machines. But menopause is not like that.
That's right.
Everything that a doctor needs, she can, or he can get
The patient can
from
get.
the patient can give to her.
That's right.
All right, great. Next question is from Allison. She's in Los Angeles, California, and she says, I'd like to switch from the estradiol patch and prometrium to your method of using the organic oils. Are there any practitioners in West LA who know this method? Thank you.
There was and there is, and again, if you go to Find a Doc, the team member of ours that helps with all these referrals can steer you in the right direction. I just recently learned that the one in LA is not, practice is full, is not accepting new patients. But again, California, we have a physician in California that is practicing telemedicine, so it's an easy thing to do, as we explained in the answer to the first question. There was something else I wanted to address. Yes, it's the switching from the estradiol patch into prometrium.
Yeah.
Very easy to do. We even have a video of it on our website. And so, and if any physician that you know that you like, if you have a physician that you already like, that physician can call and consult with me for no charge. I'll instruct that physician how to order the organic oils, very easy to do, and how to make that changeover from the patch and the prometrium into the transdermal estrogen and progesterone.
All right, great. On to the next. We're blazing through them today. This one is from Sandy. We know Sandy well. She's asked quite a few questions, good questions. She's from Carlsbad, California. Boy, they're all coming out of California today. I know Dr. Rosensweet runs the 24-hour urine hormone test Let me read that again. I know Dr. Rosensweet runs the 24-hour urine test a few months after he prescribes starter dosages of the bioidentical hormones and after a woman begins to feel better. Is there any need to run standard blood work or any other test on hormone levels before bioidentical hormone treatment begins? Thank you for your help.
Almost. And great question. We ask a woman to show up at the first visit and bring with her any blood tests, any kind of tests, any imaging, mammograms, etc., that are pertinent and relevant and recent.
Yeah.
We don't order that prior to that first visit. I always like to see in all of our physicians we've trained and nurse practitioners we've trained, we like to see what the patient brings in so we're not duplicating anything.
Yeah.
Yes, and blood tests are part of an important medical evaluation. If someone arrives at that first visit and they've got a gorgeous panel of blood tests that have done and they're up on their mammogram and other stuff, we don't have to order anything.
And there is no relationship. She could have done the blood work prior to getting on hormones. She can do the blood work after being on hormones. It's acceptable either way.
Exactly. We can, in that first visit, the hormones can be prescribed.
Yeah.
Now, there is an exception. There's a certain test called the sex hormone binding globulin. And that's a blood test that no matter how fantastic and amazing a blood panel someone walks in with that they just had 3 months ago,
Yeah.
if it does not contain the sex hormone binding globulin, I'll want that blood drawn for that test prior to the starting of the hormones. They can go to the pharmacist and pick them up or have the hormones shipped to them, but before they start those hormones, I want something called the SHBG, sex hormone binding globulin. There's a lot of reasons for that. We explain it in the book. The physician or nurse practitioner can explain it to you. That's the one blood test that I find I don't like to start hormones until we get that one test.
Got
It's
it.
interesting. It's irrelevant for a lot of women, but it is relevant for some, and we like to get that right away.
Great. All right, how are we doing? We're doing good. We're fast
right.
today. Who are we?
Am I me?
Something's not right in the universe. We're fast. This is Dale, interesting spelling, from Sarasota, Florida. And what she writes, I'm assuming that's a she, is does insurance cover treatment?
Ah, the great frontier. There are many practicing physicians who are treating women in menopause that bill insurance for the consultations. In fact, in traditional medicine, almost everyone. When you move into the area of holistic medicine, complementary medicine, functional medicine, a lot of these physicians and nurse practitioners have had to let go of trying to bill insurance.
Or may I say that they have, for very complex reasons, chosen to let go of billing insurance.
Precisely.
Because a lot of what a holistic doctor does just doesn't fall under a code. Menopause
is different.
does.
Even what a holistic doctor does fall under a code.
Yeah.
But it's a whole deal to have a staff capable of billing insurance properly.
Yeah.
And functional medicine doctors, holistic doctors, they tend to spend a long time, so they're not going to get paid for the amount of time that they spend. So it's a complex issue, but here's what you really need to know. The physician or nurse practitioner that you choose to see very well may be one who is billing insurance very successfully. There's obvious codes. They've been around for 50 years on how to bill for treating a woman in menopause, and they're already used to billing successfully. And so all your consultations are going to be paid for, but it totally depends on the quality of the insurance company that you have and the specifics of your specific policy. To cut to the chase, there are physicians and nurse practitioners who are treating women in menopause with bioidentical hormones, and they're billing insurance companies successfully. End of story.
Yeah.
Now let's move on to other aspects. How about the hormones themselves? Very less common. There are compounding pharmacies, and there's a few of them, and we could name names if you connect with us, who are going to the effort, the extraordinary effort, to bill insurance company for bioidentical hormones, compounded hormones. This has not been the desire of the insurance companies to add on this thing that they didn't know about And so we get varying reports about how easy it is for them, the patients, to get reimbursed. Once again, it's going to come down to the individual's pharmacy willingness to bill an insurance company.
And it's
And it's
like
gonna
anything, sorry.
It's going to come down to the quality of the policy, the quality of the company, and the specifics of the policy, whether you're going to get reimbursed for the actual hormones. That's a big deal. I mean, if you'd like to have insurance cover anything, you'd like to have the ongoing expenses of the hormones covered.
Yeah.
And then there's the third category, and I know you have another question there.
Yeah.
It's the laboratory testing. The laboratory that we recommend for hormone testing does require payment up front for the $280 it takes to do a 24-hour urine hormone test. The only one that I would ever recommend is that 24-hour urine hormone test. I know you think of other ones that could be possible, but not until something else has happened. The 24-hour urine hormone test is what is required to assess a woman who's in menopause and being treated with bioidentical hormones. At least one of the labs, and I think the other two as well, will require payment up front, but they will bill the insurance company, and their track record about getting the patient reimbursed is pretty good. But again, it comes down to the quality of the company and the specifics of the policy.
The only ingredient I wanted to add is that we're in a unique place and time right now, and that's that the world is expanding in the direction of understanding the value of things like organic. And every day, more and more, let's say, traditionally trained gynecologists who might not have understood this a year ago are going, I get this, and we're seeing this. So why am I bringing this up? Traditional gynecologists, as an example, are really good at billing insurance. They've been doing it a very long time. And it's just possible that your existing gynecologist might want to take this on as a project, and she or he is going to have an easy time with billing, at least the first part, and that would be their services, their consultations.
And we can assist them with that.
Yeah.
We can assist them with the prescribing. I mean, this is one of the main things we do, is we teach physicians and nurse practitioners, and now even prescribing pharmacists, how to treat women in menopause with bioidentical hormones. And so they can call us, they can email us, and we'll help them bridge that gap, because that's one of our desires, is that any physician or nurse practitioner in the United States and ultimately the world who wants to learn how to do this properly, and I mean excellently, to master this, that's one of the main things we help them do. So ask your own physician.
All right, great. On to yet another. We still have time. Amazing. This is Maria. She has a bunch of initials after her name. I don't even know what they mean. You do. CHHC FDN-P. She's in Basking Ridge, New Jersey, and she asked, I watched your webinar with Carmen Hunter and enjoyed it immensely. I would like to find out about auditing your training course, and I would love a referral to a doctor for myself. Thank you for your time. Regards, Maria.
The easiest way, Maria, is to go to menopausemethod.com and ask for Find a Doc, and in your Find a Doc, suggest that you would like a referral, plus you would like the training, and one of our team members will link you right up, because several health coaches that were present for that wonderful podcast with Carmen are already interested, and they're already viewing the educational program, and they're also getting linked up with prescribers.
Yeah.
So, we actually, if you could back it up a little bit, there was a test there was a question that came up before Maria.
Oh, yeah. Sorry, I missed one.
Yeah, from Regina.
Regina. All right, great. And I think this should be our last question of the day. We've certainly gotten through a lot of them today. This is Regina. She's from Sanger, California. And she says, I am 69 years old, a health coach, and very healthy. I address health issues with nutrition and supplements for many years now. I have had heart palpitations when stressed. However, nothing critical shows up on heart exams. I know I have hormone issues based on Dutch test results and symptoms. At my age, can I benefit from bioidentical hormone therapy? She's 69.
Couple questions in there.
Yeah.
Number one, heart palpitations. This is the very best thing about your heart palpitations is you went to a physician and they can't find anything. And
Yeah.
that's what you want when you go to a doctor or a nurse practitioner. You want them to be scratching their head. You say, I really don't know what's going on, because I'm sure they did some basic tests, because they are excellent, and I mean excellent, at finding stuff when it's not good. But when they say, I can't find anything, and I did these tests on you, that's what you want to hear from them. You say, thank you so much. I'm so glad you don't know what's going on. I'm just kidding, being facetious. And then heart palpitations as a result of insufficient hormones is a very common thing. It's something that emergency room doctors don't necessarily think of, but a woman can show up, a relative of ours, showed up in an emergency room with heart palpitations and chest pain, no less, had a cardiac angiogram performed on her. That's quite an intense procedure. And they found nothing. Well, that's great. But they were wondering whether she was having a heart attack, and so was she. That's why she went to the emergency room.
Yeah.
But her story is replicated all over the place. And how in the world can that happen? Well, when your body is alarmed and it doesn't have enough estrogen, the only hormones it can throw at the biological stress response is its usuals, which is adrenaline and cortisol. But if it doesn't have estrogen and testosterone, which it does not have at the age of 69, the only thing it can throw at it is more adrenaline. And adrenaline is enough to give you heart palpitations. Absolutely. If I injected adrenaline into you or into me, we'd get heart palpitations. Well, when someone's own adrenal gland injects a sufficient amount of... So the good news is the heart palpitations could represent nothing other than ovarian hormone deficiency. Happens all the time.
Yeah.
And 69, from my perspective, a woman should be treated every single minute she's on Earth until she leaves Earth. From the time her hormones start to diminish and until the very end.
Because you've said many times, it starts earlier than what's traditionally known as menopause.
That's right.
And just keeps on freight training down and down and down. And the need doesn't go down, just the levels of hormones do.
The need increases.
Yeah.
As the hormones go down, the need increases.
Yeah.
And what are we talking about here? The long-term stuff, the bones, the muscles, the mood, the sleep, and on and on and on, as we explain in great detail in the training program, and also in the in our book, Happy Healthy Hormones. And 69, nothing's ever too late. I started hormone treating elderly women on my mother-in-law when she was in her late 80s, and my mother when she was in her late 80s, to significant benefit for both of them. In fact, we have a special formulation for elderly women. Not 69, I would not call an elderly woman. From my perspective, it's a younger woman. But yes, I would definitely get these hormones. What do they affect that's really going to matter to you 20 years from now? Mood, arteries, cognition, muscles, bones, vagina, bladder. It's the difference between wearing Depends, these adult diapers,
Heart.
and not.
Heart.
Coronary arteries. These hormones are very crucial for natural function. So whatever age you figure it out, my best recommendation is to get on bioidentical hormone replacement. Now, if you have a very strong intuition that you don't want to do that, I never suggest to a woman that she override her own personal will. What I do suggest is, well, investigate it further. Read our book. Read other books. Learn about it. Because if you have a question about it, a lot of times your questions will be answered by learning more about the subject. And there's wonderful information about there that you can learn. Again, our book. And then if at the end of whatever research you've done on it for yourself, this is written for lay people, it's not written for, we have other training programs for professionals. If you arrive at the conclusion of, I don't want to do that, respect it. Or if you arrive at the conclusion of, I think I do, well, we can help you connect up with someone. The test that you mentioned is any test. That would be a blood test, the test that you mentioned, saliva test, 24-hour urine hormone test at the age of 69 is going to show you to be low in hormones, and that's very accurate. The reason I would like to say that once you're being treated with hormones, there's no test that I would recommend other than the 24-hour urine hormone test. Now, we've taken this up before as a question, but I want to emphasize that. Any and every test that tests hormones is going to show you low at 69 if you're not taking hormones. Once you start taking hormones, there's only one test that's going to give you what you really need to assess how much of those hormones are making into my body, what levels are they at, and are they hitting in the right zone. Not too much, not too little, but actually in the target, in the absolute best zone.
And I've watched you teach a lot of doctors about this. And for reasons that I can totally understand, there's sometimes resistance to it. For one thing, change. Doctors have learned a method and it's been something they've used. And for another, this is the most awkward of them. Although you've said many times, what the heck, it's not that bad. But the reason why I brought it up,
urine hormone
by the
test?
24-hour urine hormone test, but the reason that I brought it up is that who better to understand the logic than a medical doctor? And what have I heard many, many, many times over is once you describe to them the logic behind why it's the only one, the light bulbs go off.
They get it.
They get it. They get it. It just makes sense.
And
It's
I
high
didn't get it
science.
until I ran my first hormone test. A friend of mine had told me, hey, listen, you want to understand what's going on in a woman's body when you're treating her with hormones, while you're treating her with hormones?
Yeah.
Do the 24-hour urine hormone test. And when I first saw the report and got help interpreting it, I went, that's why my friend recommended this, because it's fantastic. And there's no orthopedic surgeon when a patient has a suspected fracture in their wrist, for example, that's going to try and treat that without seeing an x-ray. And the orthopedic surgeon knows it, and they're going to tell the patient, we need an x-ray. Well, when any hormone doctor really understands the subject and really knows what they're doing, they're going to say to the patient, and we're going to do the 24-hour urine hormone test, and the patient isn't going to wince, because the doctor themselves, or the nurse practitioner herself, or themselves, they know what they need, and the patient isn't going to resist them. It's when they don't know about the importance of and the proper way to test that they get a little timid around asking for a 24-hour urine hormone test, and the patient feels the timidity and says, do I really need to do it? Moral of the story is, once someone who wants to be expert in treating women in menopause with hormones realizes the tools they need, which includes the 24-hour urine hormone test, to properly evaluate a woman while you're treating her, they get it in their backbone, and they say it. And now we're going to do the 24-hour urine hormone test, and the patient never winces. In all 25 years that I've been treating women in menopause and asking for that test, I never get pushback, because I know it's needed. And so my women patients trust me, and they do it. So I have heard that there is this thing called resistance out there, but I wanted to elaborate a little bit on where that resistance comes from and how it's unfounded.
Yeah.
And you want to practice good medicine in treating women with hormones? Your best friend is going to be the 24-hour urine hormone test. You'll see what I mean when you do it.
Well, great. It's been a great week. We covered as many questions as we've ever covered, ever. And we will be back here next Thursday at 3 for yet another one of these live answering of your questions. So feel free to write them in. We really love to answer as many as we can get to.